let's talk about critical and diagnostic thinking for better clinical judgment, Chapter 12. Upon completion of this lesson, you will acquire knowledge for course objectives 1, 5, and 6. In addition, by the end of this lesson, you will meet the following objectives. To define and explain the importance of critical thinking in nursing. To identify the types of reasoning based on critical thinking. To compare inductive and deductive reasoning. Be able to explain the 8 elements of reasoning in critical thinking. And identify attributes of critical thinkers. What is critical thinking? Critical thinking is a habitual, rational, scientific process of thought that is used to determine actions within the scope of nursing practice. Critical thinking is purposeful and rational. It sets out to accomplish a specified goal. It's purposeful, goal-directed process of inquiry that uses available facts, principles, theories, and abstractions to analyze, make inferences, solve problems, or arrive at decisions. In nursing, critical thinking is used each time a decision must be made to direct care towards a desired outcome. We use Pearson's red model often in critical thinking, and it is a skill the RN must understand and incorporate into practice. So let's kind of look at the definitions of critical thinking. This is a diagram of the red critical thinking model. It's Pearson's RED. R stands for recognize symptoms, E is to evaluate arguments, and D is to draw conclusions. I thought I would add a brief humor here. Are you sure the current research is based on nursing theories? Do you sometimes feel this way when you are trying to learn a new procedure or skill? Let's review the purpose of critical thinking. It is to ensure that the decision-making process will lead to the best possible patient outcomes. There is a need for critical thinking. It's needed to decrease errors and sentinel events and to improve patient care systems. It's needed to give careful, complex consideration of what must be done and how best to do it. And it's needed for evaluating nursing care. In using critical thinking, the nurse considers evidence-based practices and uses nursing concepts and theories to guide decisions for the patient care. Let's take a look at the types of reasoning that are embedded in critical thinking. First, we'll look at reasoned thought. It's discriminating, prudent, and does not allow emotion, feelings, or prejudice to skew decisions. It's reasoned thought that eliminates bias and emotions. It can lead to incorrect interpretation of intense situations requiring immediate decision making. Then we have clinical judgment. It's a perceptive understanding of a situation based on knowledge, empirical data. This is data that can be observed or experienced. And then theory and scientific inquiry. It decides whether to proceed with or revise a course of action. Critical thinking is necessary for sound clinical judgment that involves collaboration with other healthcare providers, communication with the patient, interpretation of data, and analysis of theory. Critical thought includes experience, knowledge, and skills that are required in order to think critically. It's disciplined, rationale, and self-directed activity that uses standards and criteria. It assists the nurse in making more effective clinical decisions. Nurse who engages in critical thought will meet more of the patient's needs and affect positive patient outcomes. Remember, both reasoned thought and clinical judgment are components of the critical thinking process. Critical thinking skills consist of several types of thinking skills. Let's review some related thinking skills. we have diagnostic thinking. It's flexible and embraces complexity. It's based in the scientific process but uses both analytical and intuitive cognitive processes. Characteristics are ability to grasp and analyze the complexity of any given situation. It's a use of all data at hand to make both inferences and deductions. So recap, diagnostic thinking requires not only observation of overt signs, but also of covert reactions and symptoms. Cultivated thinking includes engaging in critical thought. This thought is organized, enlightened, and educated. It does not assume that all pertinent information has been gathered yet. It seeks the latest and best information available to make the most appropriate decisions. An RN who continues to update data and stay well informed will best meet patient needs. So let's recap. Coherent organization of assessment data and consideration of evidence-based practice are part of cultivated thinking. An experienced nurse recognizes personal traits that interfere with reasoning abilities and learns to be open-minded. Now, let us look at deductive reasoning. It's a process of going from broad information to specific details or from general to specific. Deductive reasoning process includes taking general assessment data, drawing conclusions, identifying problems or needs, and formulating a plan of care. For an example, nursing process because it involves taking data and deducing a plan of care. Taking general information and narrowing it down to specific needs to create a plan of care comprise is an example of deductive reasoning. Nursing diagnosis use this specific information to support their use. And then we have inductive reasoning. This occurs when a patient presents with symptoms or problems the nurse has seen before. From the assessment data gathered, the nurse makes inferences, such as conclusions or assumptions, and asks for further questions and makes decisions. The strength of the inference is based on the extent of the RN's knowledge and experience. It goes from specifics to generalities and infers the likely outcomes that are based on supporting data. So recap, the opposite of deductive reasoning is inductive reasoning that takes specific data and makes a general claim. Okay, let's do practice question 1, related thinking skills. After a nurse gathers data from the assessment and identifies needs, the nurse develops a care plan. The nurse is demonstrating which type of reasoning? Is it inductive, intuitive thought, deductive, or point of view? Have you decided on an answer yet? Correct. It is answer number 3, deductive. Taking general assessment data, drawing conclusions, identifying problems or needs, and formulating a plan of care comprise a deductive reasoning process. Okay, now we're going to discuss the elements of reasoning and critical thought. These are 8 elements that are proposed by Paul in 1995. First element, purpose, recognizes that all thought has an agenda or asks the question, what are you trying to accomplish within the context of your thought process? Critical thought must begin with the end or the purpose in view. Knowing what and keeping that always in your mind is imperative. Then we have question at issue. It defines the purpose clearly and accurately. The question at issue or the problem at hand is relevant to the purpose. Next element is point of view. It explains or illustrates how the data can be understood from multiple positions. The nurse must understand that in patient care there are multiple points of view, from the patient, the family, the healthcare team, and even the insurance companies. Communicating in a variety of ways may be necessary to facilitate optimal patient care. Next element is the available information. Based upon available information, that's data that are at hand, will give a greater understanding of the problem. gathering historical and assessment data from the patient as well as seeking all available secondary source information. This assists the critical thinker RN to support the plan of care and understand the potential outcomes. A nurse should consider information from many available sources, both primary and secondary. Then we have concepts. As the thought process develops, concepts from that begin to explain the problem at hand. These ideas, theories, or mental images of something that do not yet have a tangible representation. Concepts or ideas are generated during the critical thought process. These concepts are then validated with tangible care processes. Don't forget assumptions. Educated guesses, hypotheses, or stated or unstated beliefs are accepted or held as a truth without proof. Concepts lead to assumptions or educated guesses, which the nurse must then check against the data for verification. Then we have implications and consequences. It's defined through outcomes, expected or unexpected. Every action or intervention has both implications and consequences that are good and bad, which must be carefully considered before care is planned or provided. And the last of the 8 elements is inferences, the conclusion that results from or is a summary of the process. Critical thought culminates with inferences drawn about patient care, diagnosis, and etc. So, what is the structure of critical thought? Critical thought is fluid and circular. The critical thinking process assumes that questions are formed for each step of the nursing process, asked and answered. Questions are asked and answered many times during the process of critical thought. Concepts are considered and discarded. Assumptions are made and disproved, and the care plan is evaluated on many different levels. So what are the attributes of a critical thinker? First, we have curiosity. This is the desire to understand what something is or how it works, to be compelled to explore beyond what is immediately obvious. It may also imply skepticism or the need to challenge beliefs in search of other possible conclusions or truths. It's a relentless pursuit of truth. It's to retain an open mind, to look freshly at the world and at our patients, and to practice discovery every day. It does not use prejudice. It is a curious nurse that challenges the boundaries of care and looks for new solutions in nursing theory and evidence-based practice in a desire to provide superior patient care. And then we have diligent. This is pursuit of evidence and information. The RN seeks relevant evidence and information as part of the process of the decision making. They collaborate with experts and consult other references while developing the plan of care. Pursuing information to make an informed decision, finding evidence to support the plan of care, and utilizing the knowledge and expertise of the healthcare team are the actions of an experienced nurse. Rational thought. This is the knowledge gained through study and experience. It helps the nurse predict likely outcomes of planned actions or interventions, thus making sound clinical decisions based on all available information. Experience is the foundation of rational thought, which the nurse uses to guide decisions about actions and interventions. How about reflection? This is the process of looking back and reconsidering ideas, thoughts, beliefs, and actions. It helps the nurse improve practice through careful self-critique of prior scenarios. Reflection of past actions and thought processes will help the nurse understand the critical thinking process. Consideration of what could have been done differently, what decisions were successful, and what information was useful can improve the nurse's critical thinking process. How about creativity? This is the ability to be innovative, resourceful, and inventive. The nurse recognizes patterns that are present, but understands that outcomes are often uncertain until tested. Creativity is an important attribute of the critical thinker who engages in alternative thinking, thus producing unique solutions to seemingly unsolvable problems. And then we have intuitive thought. This involves one's sixth sense, instincts, or insight. Intuition implies perceptiveness, the ability to see or sense subtle patterns or characteristics. It can be referred to as that gut feeling. Intuitive thought is the trait of an expert nurse whose perceptiveness allows them to gather information from all senses and formulate accurate conclusions. Okay, so let's look at practice question number 2, attributes of the critical thinker. A nurse wants to develop attributes of a critical thinker. Which attributes should the nurse practice? Will it be intuitive thought, predetermining purpose, diagnostic thinking? Will it be concepts, assumptions, or consequences? Will it be rational thought, inferences, or implications? Or is it going to be reflection, creativity, and curiosity? Have you decided on an answer yet? Correct. It is number 4, reflection, creativity, and curiosity. The nurse who engages in critical thought does so on a foundation of knowledge and other specific attributes that support the process, including curiosity, diligence in the pursuit of evidence and information, rational thought, reflection, creativity, and intuitive thought. So how can one foster critical thought? The process of critical thought is rooted in discipline, exemplified by being true to the standards of thought, testing one's thought process for clarity, accuracy, specificity, relevance, logic, consistency, depth, and significance. It is the individual RN's responsibility to develop critical thinking skills, and the use of concept maps may also foster critical thought. Discipline is the key to the process of critical thought. Understanding that critical thinking is nonlinear and has no set formula can be the first step in developing good critical thinking skills. This concludes this lesson, and always remember that your present situation is not your final destination. The best is yet to come.